This is Margaret. She's been experiencing shortness of breath lately that becomes worse when she walks around. She also notices her ankles have been swollen, she's been fatigued lately, and she hasn't felt like eating much. After some time, her daughter convinces her to go to the hospital. Now that she's at the hospital, they've taken a set of vitals and they've completed an EKG. The EKG shows sinus tachycardia with a heart rate of 104. 2 liters of oxygen is applied via nasal cannula and blood is drawn. Some things to note are that her BNP and creatinine levels are elevated. A chest x-ray is completed and is clear, and then she is taken for an echocardiogram, which eventually shows that her ejection fraction is 40 to 45%. The doctor orders IV Lasix and puts the patient on a 15 ml fluid restriction, places orders for strict I's and O's, and a consult to Margaret's cardiologist. Margaret has a history of coronary artery disease and has had stents in the past, as well as a history of hypertension, high cholesterol, and diabetes, all of which she manages through medication and diet. The cardiologist assesses the patient and determines she is having new-onset congestive heart failure. He explains that the symptoms the patient has been experiencing are consistent with this diagnosis, and he also provides her a complete list of other symptoms to be aware of and monitor for. The provider explains new medications she will be starting the patient on, which include guideline-directed medical therapy. This means she will be getting a beta blocker, as well as an ACE or an ARB. The provider also prescribes a diuretic that the patient will routinely take, as well as an increased dose that she can take in the chance that exacerbation symptoms begin to arise. After 4 days of diuresing in the hospital, Margaret is doing much better. She was able to wean off the oxygen, and her edema, dyspnea, and fatigue have all improved. The nurse educates Margaret on some modifiable risk factors that she can adjust to prevent exacerbations from occurring, including diet and exercise management and limiting alcohol intake. The importance of medication compliance and follow-up appointments is also reiterated, and Margaret is discharged home.
Created using Patho.